What is bronchitis? Bronchitis represents the obstruction and inflammation of the major and small airways. Bronchitis can be acute or chronic. Acute bronchitis is caused by a pathogen, often a virus, and lasts for 2 to 3 weeks. Chronic bronchitis is a more serious, long-term condition and therefore will be our focus.
Normal physiology. Air enters through the nasal cavity or mouth and then passes through the pharynx, the larynx, and the trachea, then branches into the right and left bronchi, which perforate into the lungs, and then it rebranches into the bronchioles. Each of the bronchioles terminates into a cluster of alveoli where gas exchange occurs. Now we will take a closer look into the major airway, the bronchi, and the smaller airway, the bronchioles, which bronchitis mainly affects. The walls of the bronchioles have a couple of layers. Lining the lumen of the airways is pseudostratified columnar epithelium containing goblet cells, which make some of the mucus secreted in the airway. At the bottom of this layer is a basement membrane and loose connective tissue, which is then followed by a layer of smooth muscle and another layer of connective tissue. At the bottom of the connective tissue layer lie the bronchomucinous glands. These glands secrete the majority of the mucus into the lumen of the airway to catch dust particles and pathogens, which hair-like projections called cilia lining the lumen will then sweep up and away from the lungs. Pathophysiology. The most common cause of chronic bronchitis is cigarette smoking and repeated exposure to pollutants. Both have irritants, which the body tries to get rid of by producing more mucus. This, however, stimulates hypertrophy, which is increase in size, and hyperplasia, which is increase in number of the bronchial mucinous glands as well as the goblet cells in the lining of the airway. Simultaneously, some chemicals in cigarette smoke make the cilia short and less mobile, making it harder to move the mucus up and out of the bronchioles. As a consequence, the increase and trapping of mucus impedes gas exchange. Since the bronchioles are blocked, this means that significant amounts of oxygen can't travel to the alveoli and diffuse into the bloodstream. This also means that huge amounts of CO2 can't leave the lungs and gets trapped in the alveoli. This causes a significant increase in the partial pressure of CO2 in the intra-alveoli space. Because there is now higher pressure of CO2 in the lungs, it makes it harder for CO2 in the blood to diffuse into the alveoli, and so they get trapped in the bloodstream. Acid-base balance. Accumulation of CO2 in the bloodstream due to impaired lung function causes a respiratory pH imbalance. How? One molecule of CO2 combines with one molecule of water to form carbonic acid, which then breaks down into hydrogen ions and bicarbonate. The body has a way of managing the buildup of bicarbonate molecules, but the accumulation of hydrogen ions causes a decrease in pH, making the blood acidic. This phenomenon is called respiratory acidosis. Acidic blood is toxic to your cells and can reduce their abilities to function properly. When your cells are impaired, they cannot effectively utilize nutrients and have a hard time fighting against bacteria and viruses. As a result, you will have less energy and can develop numerous health problems.
Symptoms related to pathophysiology. Surrounding the walls of the bronchioles are circular smooth muscles. The buildup of mucus causes the smooth muscles to spasm, making them contract, which forces the mucus out of the bronchioles and to the outside world. This is how you get the cough, our body's natural way of getting rid of the irritants. At the same time, the irritated smooth muscle cells release cytokines, such as interleukin-1 and 6, which play a critical role in triggering chronic inflammation and bronchitis. This mechanism induces redness, heat, pain, and swelling of the smooth muscles lining the airway. People with chronic bronchitis are sometimes referred to as blue bloaters. Why? Blue refers to their color. The accumulation of CO2 in the bloodstream makes them appear a little bluish in color. This can show up in the lips, nail beds, or even in their complexion. Bloater refers to their shape. Due to their situation, people with bronchitis can get enough oxygen to supply their body. To compensate with this, they take deeper breaths, which in turn gradually increases their chest volume. Since chronic bronchitis reflects a long-term condition, this response mechanism done constantly causes the diameter of their chest to actually increase, making them look bloated. On top of that, sounds not normally heard in the lungs are present. Mucus in the lungs cause people with bronchitis to wheeze, due to the narrowing of the passageway available for air to move in and out. They also have crackles or rales caused by the popping open of the small airways. Causes and risk factors. Constant smoke inhalation, mainly of cigarette, is the most common cause of chronic bronchitis. Repeated exposure to dust, chemical fumes, vapors, or any other kind of air pollution in the environment or workplace. Low resistance caused by another acute illness such as cold or from a chronic condition that compromises the immune system. Recent studies suggest that genetic factors may also play a role in developing chronic bronchitis. Effects of bronchitis on the three key concepts: protein and cell membrane. Inhaled irritants such as ammonia, sulfur dioxide, hydrogen sulfide, or hydrogen chloride causes sensory fibers that innervate the airway to release acetylcholine or ACH. A type of muscarinic receptor located in smooth muscles and bronchial mucinous glands is called cholinergic receptor, which the ACH binds onto to produce certain effects as part of your airway defense mechanism. One effect is the constriction of the bronchioles, which serves to reduce the penetration of the toxic irritants and increase the efficiency of cough mechanism. Another effect is the increased mucus secretion from bronchial mucinous glands and goblet cells for more efficient removal of the irritant. Lastly, it causes an increase in blood flow and capillary permeability to bring in more inflammatory cells such as macrophages and neutrophils that can manage the harmful irritants. Homeostasis is disrupted because there is impaired gas exchange, increased number of goblet cells and mucinous glands, which results in too much mucus production, inflammation of the smooth muscle in the airway lining, and lastly, accumulation of CO2 in the bloodstream causes respiratory acidosis, which makes the blood acidic and reduces the abilities of your cells to function properly. In summary, the bronchial mucinous glands and goblet cells produce the mucus that the cilia will sweep away from the bronchioles. In bronchitis, the irritated smooth muscle cells release cytokines that triggers inflammation. In addition, the body tries to get rid of irritants by stimulating hypertrophy and hyperplasia of the mucus-producing cells. These factors in the long run impedes gas exchange and disrupts homeostasis.